Hi, and welcome to It's Sybil and a very special edition of It's Sybil. It gives me great pleasure to introduce and to have a conversation with our friend Dr. Altha Stewart. She is a longtime listener of the Old Tom Jordan Morning Show. That's when I had an opportunity to meet her at an event in Memphis, and it was a great opportunity. And we have extended our friendship into this new chapter of our lives. And so I welcome you, Dr. Stewart. It's great to see you, and it's great to have you with us today.
Oh, it's always good to be with you, Sybil. Thanks for the invitation.
Dr. Stewart is the past president of the American Psychiatric Association and also is serving as the associate professor of psychiatry and director of the Center for Health Injustice Involved Youth at the University of Tennessee Health Science Center. That's a big business card you got there, Doc.
Yeah.
Uh, what does that mean?
Well, as the director of the Center for Health and Justice Involved Youth, I'm responsible for the last 6 years. I've been responsible for making sure that our young people here in town who were previously being directed into out of home placement, whether it was the justice system or child welfare, for issues that they were having that really dealt with their mental health or
Mhm.
their exposure to trauma in childhood in their communities, and trying to direct them into services so that they could stay in their homes, in their community, in places where they could be loved and cared for and protected.
Mm.
And so that's what the center is responsible for. Since we last spoke, however, I've been named Senior Associate Dean for Community Health Engagement. And so now my role is expanded, and I'm working a lot in the area during the pandemic, in the area of COVID-19, the testing
Wow.
initially, and now the vaccination, to really get the word out to underserved and vulnerable communities about the importance of their health and protecting themselves during this pandemic.
That's a lot of work, Doc. How and so it sounds like it's 24/7.
Well, I've got a great team that work with me on this. We're part of the university structure. So I have all of my colleagues across the medical field, the researchers, the clinicians, the educators who are helping us to mobilize the resources of the university and get all of this work done.
And it
But it
really
is a
does
lot of work.
it takes a village though, doesn't it?
Yes, yes, it does. Yes, it does.
So let me ask you this because you said last we talked because every time that we do communicate, whether it's by Twitter or texting or whatever, and you're always asking, "Have you been vaxxed? Are you?" And so this is your work right now is to make
Yes.
sure that the community is vaccinated as well as so they're for their physical as well as their mental health.
Yes, yes, exactly. COVID exposed a lot of the undercurrent of things that many of us knew were problems, but it really brought it to the forefront. And so, for people who live in communities where they have limited access to any health care at all, where they have housing instability, food insecurity, transportation issues, are considered essential workers, but not given the protections that they need to be safe themselves and to protect their families, those are the individual communities and individuals that I am focused on working with now to make sure that they get through this pandemic with as little challenge as we can possibly help them to have.
Did you immediately understand and see the impact that this pandemic could have on us, having known about the mental health of our communities, and been in that for so big a part of your career? Did you recognize how this pandemic was going to affect us, both physically and mentally?
Yeah, unfortunately, there were signs and we could predict once we began to see the fullness of the pandemic as it grew last year, 18 months ago now, I guess. Once we began to see that, it was a pretty straight line to the kinds of issues we were going to face the further into the pandemic that we got. I mean,
Hmm.
when you look at communities that have not had access to good health care, you're set up for the kinds of comorbid, vulnerable diseases and issues that challenge you when something like a pandemic arises. People who live in crowded conditions,
Hmm.
multi generational households, communities where there is a lot of insecurity in housing and food and access to transportation, places where people are working minimum wage jobs that suddenly became essential. The people who
Mm.
stocked our shelves, the people who drove the bus, the people in the hospitals, not just the doctors and nurses and others, but the people who fed the patients, the people who kept the cafeteria going, the security guards who manned those doors to make sure that anybody coming in was supposed to be there, particularly as the pandemic grew worse. I mean, these are the people who had the least support at the beginning of this. We declared them essential and then
Mhm.
treated them just like we always had.
Mhm.
Uh,
And not
and you,
and
as
not
a,
holding them in it
yeah,
to the esteem that they should have,
yeah,
and regarding them as
yeah.
essential, not just saying it.
Yeah, I
Yeah.
mean, in the early days when people said shelter in place, these were the people who had to leave their homes, go
Mhm.
out and do those essential duties, and then come back where their children were watching TV, where people went out and never came back because they died of COVID,
Wow.
or
Yeah.
grandma who you had always been able to visit after school got sick and was in the hospital and never returned,
And
and
no one
nobody
could go see her.
and no
There
one
was
could go
there was
see her.
none
You
of
couldn't
that.
talk to her. And this assumption that people could do all of this and that it would just float nicely along and everybody would handle it. If you live in a place where there is no place for you to quarantine from the rest of the family, how do you manage to not worry about if your family is going to be safe with you coming back and forth? And these were the kinds of things, unfortunately, that we didn't as a society pay attention to. Work at home, hook
Yeah.
up your computer. If you don't have a computer, you don't have access to the internet, and your home is not conducive to work, or you don't have the job where you
Mm.
can work from home. We didn't really pay enough attention early on. And that is unfortunate.
Yeah. Not only unfortunate, but for you, and how receptive were people, those in power, those in control of these situations? How receptive were they to you and your peers when you told them, "Look, this is something that we need to work with in conjunction with getting rid of this virus or doing what we
Yes.
can to stop the spread." How receptive were they to what you were telling them?
Well, for me, there were two communities. There was the group of people for whom remote work was a part of their corporate business. And so they needed to adapt. And they frequently called on people like me to help them understand, how do my managers manage in this virtual environment? How
Mhm.
do we make sure our team members or associates or staff or whatever designation they gave workers, how do we make sure that they're getting what they need while we're expecting them to keep up the productivity? So that was one group of people,
Wow.
and they were actually very invested in making sure that they were paying attention to people's needs, that they were giving people time to address their psychological distress issues.
Mhm.
And I have to say, many in the corporate environment saw the need and asked for the help. On the other hand, those people, the essential worker people,
Yeah.
I don't know that the grocery store worker had access to that same kind of support on the job.
Mhm.
I didn't personally hear that. I didn't see the stories where people reached out to say, how do we help our team members who are stocking those shelves with the paper towels and the toilet tissue that people are running to
They're
get?
waiting for you to
Yeah,
come,
yeah,
yeah, to get to the store,
and
right.
and remember now, in the early days when we really weren't sure what was going on, people had attitude.
Mhm.
You went to the grocery store and you were told there was going to be toilet tissue on Tuesday, and you were there on Tuesday and there wasn't toilet tissue. You took it out on somebody. I
Yeah.
need toilet tissue. I
Mhm.
need paper towels. Where's the bottled water? So there were a lot of interactions, social, personal interactions that signaled that people were really in distress. They were enraged about the changes they had to make to their lifestyle and how they lived.
Sure.
They were enraged at this sense of uncertainty and anxiety, not knowing. Every day the scientists would say, we're learning more. But for many people, it was, you don't know enough about this to tell me what I should do. So stop telling me what to do.
Mm.
And that's when all those myths and the internet universe exploded with, well, this is the real story they're not telling you, and people believed it.
Wow.
So we had to do a lot of work in the early days of dispelling myths and getting accurate information while telling people this is what we know now. We're learning more every day. Please trust this, and we will keep you posted. We started holding the Dr. Fauci's and
Mhm.
the other scientists who were working feverishly to get us either a cure or a vaccine. But even, there were some turbulent things going on.
Sure.
And when you layered on the
There's just it
injustice,
really is layer upon
yeah, yeah,
to the skies.
the social and racial injustice that exploded during that same time, it was really a pandemic in triplicate.
Mm.
Because there were economic issues with the workforce, there were the racial and social issues with all of the turmoil that
On
was
our
going
streets,
on,
yeah.
and then there was this pandemic that we really hadn't wrapped our arms around yet.
Right. Doc, let me ask you, as we are going into the new year and going through these things, and we're still going through all of
Mhm,
this. We're
mhm,
still going through the racial and economic injustices. We're still going through the pandemic. I don't care what people say. We're getting new surges reported all the
yeah,
time with whether it's the old Delta or the new Omicron or whatever it
mhm,
is. But how can we help people who are still going through this, who are still getting beat up upon as they are
mhm,
the delivery people, still as the people in the hospitals who still aren't getting the respect that they deserve? How
mhm.
can we help our friends and families to ease their mental disease and stress?
I think there are several ways to answer that, Sybil. One is that we've got to acknowledge that there's still a lot we don't know, but
Mm,
there are some things that we know for sure. We know for sure that the vaccination helps more than anybody ever thought it would, and that people who are vaccinated, while they still may have the illness,
mhm,
get the virus, it is now documented that it'll be less severe, and so we need to kind of build on that knowledge that it is better to be vaccinated than not vaccinated. It's better to have a booster than not have a booster. And for our children, now that they're eligible, it is better for them that we get them vaccinated as soon as we can. And those are just basic
mhm,
acknowledge that this is the foundation we need to build from. The next stage is understanding that we are all experiencing some psychological challenge. I don't care who you are and what your area, including people like me who work in this field, we are all being challenged on a daily basis to maintain some semblance of whether it's normalcy or sanity, depending on
mhm.
how you define it. That we
Right.
need to be acutely aware that on any given day we lose it.
Mhm,
That a particularly bad day at work can be compounded by watching the news
mm,
nonstop and hearing 7 different versions of what's going on. We have got to disconnect from the 24-hour news cycle. I know people want to know up to the minute stuff, but
mhm.
all that does is start a loop in our brain that we cannot stop, and we need respite from
Yeah.
these crises. We need to have some time where we both give ourselves some grace for
Mm,
all of the stuff we can't control and give ourselves some respite from the stuff that is piling on. We have to do that if we want to have any peace of mind.
yeah.
And we've got to practice giving ourselves time to relax and regenerate
And not feel guilt about it in
and
any
not
way?
feel the least bit of guilt. If you remember, one of the conversations we had was every morning,
Yep.
now that I can't listen to the Tom Joyner Morning Show anymore, every morning I have to get up and remind myself to start the day happy. And
Mhm.
sometimes I got to push that to the edge with playing a song that makes me happy and
Right.
kind of doing my little, to get myself really psyched up to remember I start this day this way. I got a better shot at not letting everything that's going to happen take me out.
Mhm.
And I just that's a conscious, intentional, deliberate practice of mine. And I encourage people to do those kinds of things. Whatever works for you. It may not be music. It may be looking out at the sunrise. It
Mhm.
may be that first cup of coffee and just breathing in the aroma. It may be sitting in a yoga position and meditating and doing that to center yourself.
Right.
Whatever it is, intentionally doing it makes a difference.
Mhm. I think that you have given us a lot of good information there. Who centers you? What centers you? What is your I know you may have a place away from the workplace, but for you who give all of this great advice
Mhm.
and inspiration, where do you get yours from?
I have practiced meditation for a
Mm,
while now, pre-pandemic. I have practiced that. And I read. My mother was a librarian, so
mhm.
growing up, reading was really fundamental.
Right.
And I have gotten back. I like the feel of a good book. So
Mhm.
I've gotten back to reading things, and I'm on my Toni Morrison rereading thing.
Oh yeah.
And there's a great quote, and I always mangle it, about centering based on getting to the border of where you want to be and having others come to you. It really
Mm,
helps me to remind myself that I work in an area where people always want to draw me in to their way of thinking or to do things in a certain way. And I have to, and this is my word for 2021, intentional, that
mm.
I have to think about it. I have to practice it. I can't take it for granted. And so I intentionally, when I am facing a particular challenge or about to go into a challenging setting, a meeting or something, I intentionally invoke the spirit of Toni Morrison centering
Wow.
and remind myself in that moment that what she said about get to the edge of where you want to be and let them come to you, make them come to you, that really works
Wow. That's
for me.
powerful.
It works for me. And
Mhm.
I love me some Toni Morrison.
Mhm.
I love Maya Angelou, but that quote from Toni Morrison really reminds me to do it, not just think about it, but to do it.
Yeah, practice.
Hmm.
Yeah, yeah.
Hmm.
We are talking to the wonderful Dr. Altha Stewart, and she is with the University of Tennessee, and also in Memphis, I should say.
Hmm.
That's where we met years ago at an event, a radio event there, and it has just been a wonderful friendship that we have, and it is even like we talk every day, like I do with my
Yeah.
best friend. And
We
you're
just pick up.
always
Yeah,
yeah,
we
and
just
and
pick
pick
up.
up where we left off. And
Yeah,
so,
yeah.
we really wanted to talk about this particular situation with our mental health. We are intentional, doctor, if I can borrow your word,
Mhm.
about checking in and checking up on our family and
Yep.
friends. We are working with the American Heart Association and getting to the root of good health, which is both physical and mental, of course,
Mhm,
and I'm sure you'll agree with that. But we are also talking about the fact that um, this is something that we're going to carry into the new year. This isn't just a pie in the sky thought. We are going to be intentional about checking in, checking up, getting all of those doctor's appointments in, and
mhm,
and making sure that we're on the right track, physically as well as mentally and
mhm,
and spiritually, I
mhm,
dare say.
mhm,
We are talking to Dr. Altha Stewart, and we're going to continue our conversation. We're going to talk about a couple of things. I do want to talk to you about depression, seasonal depression,
mhm,
especially during the holidays. My friend J. Anthony Brown and other comedians, especially, I find this, have been very verbal about depression at this time of year. And now that we're starting off with the new year, just days away, talking about this. And so we're going to take just a breath, if you will. We do like to do our yoga breathing. And so
mhm,
you're familiar with that. We'll take a breath, and we will come back and we will talk about a number of different areas regarding depression and getting help for people and how we seek help and that kind of thing, and your suggestions for that, especially for those of us that are still searching for that therapist. Just like a good love life, it's like dating, and some of us are better at it than others. So we'll come back and we'll talk with that. We are talking with Dr. Altha Stewart, and I hope you'll stay with us as we continue our conversation with this wonderful woman and professional about what's going on in our heads.
mhm.
Welcome back to It's Sybil. I am Sybil Wilkes, and I'm so happy to talk to our friend Dr. Altha Stewart. Thank you so much for doing this. I appreciate your time more than you know, because I really think this conversation is going to help a lot of us. And I really wanted to talk this time of year, and I'm not even sure if it's correct to call it seasonal depression.
Mhm.
Is there such a thing, or is it depression that just happens to move through the seasons?
Well, and thank you, Sybil. I should have done this at the beginning. Thank you for continuing to have these conversations that we need to have about our mental health. It's not everybody that's comfortable or willing to get comfortable talking about these things, and it's so very important. And yes, there is something that we describe as seasonal depression. In part, it is related to physical issues that have to do with the light and things in our
Mm,
brain and some chemical interactions, and that people suffer in the kind of winter months because of the reduction in the amount of light. And
right.
so for many people, light therapy becomes the real challenge, and getting that is really therapeutic. But in addition, there is a seasonal component to our mood that may or may not be related to that physical issue that has to do with this time of the year. We make the assumption, thanks to, the companies that do all of those great movies around
Mhm.
Christmas, those feel good things. And
Yeah, I'm a lifetime Hallmark girl. Yeah.
okay, well, and I wasn't going to call them out because now you can find them on multiple
Yeah,
channels.
yeah.
And the good news is, and I will say this that I'm very happy about. The good news is there are more Black people on these shows now,
Amen.
and
Yep.
so that's been a really wonderful thing. But bottom line is, we make assumptions that everybody's life is like that Hallmark
Mhm.
movie where you have a challenge, you go back home, you run into old friends, everything works out, and at the end of the movie, you're either in a love life or you're back with family and all of those problems in the past are done. And the reality is, for many, many people, that's not their experience. Holidays can be challenging, particularly for people who have family estrangements,
Mhm.
particularly for people who have experienced trauma either early in life or continuing trauma as they try to work through things with family or avoid family. And then there are the changes that we all go through, particularly those of us. I moved away from home to go to medical school and stayed away for 30 years and then returned. And so for me, coming home was different.
Mhm.
And everybody has to work through this going away, coming back, how do I fit kind of thing, if that's been your experience. And it is challenging to be tightly enmeshed with people for a brief period of time and be expected to be not only on good behavior, but that person in the family that you love to hate, that you now gotta, mama wants you to make up and behave, and you
Mhm.
really try, and then something sets you off. And there are tragedies that have occurred over the holidays, everything from death to divorce, to other stuff. And we have to make sure that we don't make that assumption that because it's the holidays, we're going to be up and happy and get everything that we want. And, if you believe in Santa Claus, that he's going to bring you, or if you're a person of faith, that this is the time where you really focus on faith and spirituality and religion. And everybody's experience during this time is different,
Mhm.
and we have to have the grace to understand. That's my other word for
Yeah.
for 2021, grace. That we've got to have the grace for others and for ourselves, that says, I don't know your experience. I don't want to dump on you all of my problems because I don't know what you're going through.
Mhm.
And if we happen to be in the same family and we happen to know that history of why this family doesn't work well when
Mhm.
they're all together, that we just need to have a little grace and understand that we can step away, that we can maybe decide not to go if it's that stressful, and not feel guilty about it.
Yeah.
If
Yeah.
being away from a family that challenges you is the best thing you can do for your mental health, then find out a way to do that, not feel guilty, and find another network of support. because nobody should be alone at this time of the year. We do need to check on each other, particularly now. And we need to understand that we are, by nature, people who like to be together. And
Yeah.
if you can't be together with the family that you were born into, because that's just too much of a challenge, um, find some other folks and make that family.
Yeah.
And don't carry the guilt if you've tried and it just hasn't worked, or if mama wants you to do it and you know it upsets her, tell her, I can come and be with you, but when they come, I really can't. I
I'm
can't
out.
do that. I got to go. And it's not that I don't love you and want to. And I hope you understand that, mama. But it's just not working. And I know you want me to be happy too.
That's right. Are there, I suspect that they're not. I think that it's all individual, but are there steps that you advise people to begin in this process? Is there a way to, I guess check yourself and then, work through the issues within
Mhm.
yourself maybe? Or does that require a professional to help you work through this as you're going through this process with dealing with family during the holidays?
Yes. Well, I think it's safe to say that some of the work has to be done by you acknowledging the reality and not the fantasy.
Mhm.
If all your life, all you've ever wanted is a family that sits around that table like in the Hallmark movie and everybody gets along, and that's never happened, and your suspicion is it ain't gonna happen, then let go the fantasy and create something that is within the reality that you have. It may be that you can spend the Christmas day and
Mhm.
tolerate that, but you can't do the week before and the week after. It's just,
Right.
that's asking too much. It may be that if you're out of town and returning, that you should plan to be with people that you can tolerate. If you got a shelter in place, who are the people? You
No,
can
who
say
is who is
I
they? That's
revert.
fine.
Yeah, I revert to my South Memphis. Um, who are the people where you can be with them for a period of time and not have those feelings of frustration, anger, and disappointment?
Mhm.
And if those people are in that town, arrange to be with them. Spend time with the others and then go back to them. And if you can, I can remember when I first moved away, I came home for Christmas and it was like the day before Christmas Eve and the day after Christmas, the day after Christmas. And I was gone before New Year's because that fit with where my head was in
Mhm.
terms of where I was with family. It wasn't that we didn't get along, but I was away and I was a different person. And they wanted me to be the person they knew, and I couldn't be that person.
Little Altha that
Yeah,
you grew
little
up with.
sister.
Yeah,
You
yeah,
you
little
must know
sister.
my brother, little sister.
We
You
have
know,
them.
and
We all
yeah,
have them. Right,
okay,
right,
okay.
right.
And you have to accept some things about yourself. You gotta be willing to tell people how you feel. And for a lot of folks, that's a scary thing
Mhm.
because we want love. We wanna be loved. We wanna be part of this family unit. And for some, we wanna have that fantasy that we've always dreamed of, and we're not ready to let that go. And as you get older, you realize
Yeah,
you can let go. It'll
yeah.
be okay.
You let go and let God. That's
Yeah,
all I
there you
gotta say.
go. Yeah,
What about depression? And I don't want to belabor the point, but I think that this is a word that many of us have come to recognize,
yeah,
if not in our lives, then in our community. How do we recognize depression in ourselves as well as others if we are of a mind and saying something's not right?
yeah.
What are there signs that we should look for?
Yeah, yeah. When people say I'm depressed, what I want people to understand is depression is not just feeling sad or blue or down. Depression is a clinical condition where if you have a distinct awareness that what you described as something's just not right, if you know yourself or someone that is close to you and you know that this is different, this is different. I'm feeling some kind of way, as
Hmm.
folks say, and I don't have that same interest and enthusiasm about life. And there are real physical challenges, appetite and sleep changes that are visible and clear and significant. If it goes for a week or two and it's kind of that same, something's not right. My mood is not what it used to be. If you were the person who was always out there talking with people and suddenly you're withdrawn, you're not interested in being out in a social environment, you don't have that get up and go about I'm enjoying life when you're withdrawing from life.
Mm,
All of those are signs that you may be depressed, and it's okay to check in with your primary care doctor even,
mm,
who can screen you for depression and advise you on next steps. Or if you know enough about it and know enough about yourself and your family history that depression could be what's going on in you, then go ahead and seek help from a
yeah.
mental health professional, you know, a psychologist, a psychiatrist, a counselor, and talk about these things and explore what may be going on that's contributing to it. And for people who have a family history where my grandmother was always, they always said she was sad. You know, my uncle on my daddy's side was in a hospital several times, or someone attempted suicide in the family, or someone was told they have the split personality, bipolar,
Mhm.
manic depression. Those are family signs that you may, in fact, be in a family where those are the kinds of psychological issues that genetically you have to deal with. And it doesn't mean that you have inherited it. It means that you are maybe at risk, and it's worth taking a look and trying to see if this could be what is going on. Because the reality, Sybil, is we have got great treatments for
Mhm.
depression.
Mhm.
Our record for treating depression rivals the record of the cardiologist, excuse me, who treats your heart problem, of the people who treat your hypertension. We know how to treat depression. We have now the science understanding of
Mm.
where in the brain depression begins, and we can match a medicine to neutralize and stabilize those things in ways that we never had access to decades ago. So you don't have to suffer from depression. And if you have some physical illness like hypertension or cancer or diabetes, depression often accompanies those things.
Mhm.
And when you treat the depression, you're better able to care for yourself in terms of following treatment for those issues.
For the
So
others.
overall, you could have a much improved quality of life if you work on the depression.
What about people who say, who may be in treatment for something and say that, well, the medicine doesn't work for me. Whatever the doctor has prescribed, it doesn't work. And so, well, what are you going to do? I'm just going to stop taking it, or I
Yeah.
have stopped because I just don't like the way it makes me feel.
Mhm.
It makes me sleepy, or what? But do you do that with your physical doctor too? I mean, if something doesn't work, then you go
Well,
back and
some
you
people
try.
do. Some people do. And that's the unfortunate part, because the understanding about the treatment of psychiatric disorders, you know, depression is an illness. It's a medical problem that is part of the problem you are having with your brain, the organ
Mhm.
in your head. And just like you said, if I had chest pain, I would go to the hospital, I would follow the treatment, and if I really felt it wasn't working, rather than suffer the possibility of a heart attack, I would talk to the cardiologist and say, "I'm still not feeling well. I'm short of breath, or I have these, you know, recurring pains or something." And you'd work with that person. You'd talk with them, I would hope,
Mhm.
rather than risk having another heart attack. It's the same thing with psychiatric illness. You talk to the person who you're working with, you explain your concern, you explain what you think of as it's not working, you help them figure out if this is the medicine, is it not enough? Have you not raised the dose to what you need? These are the times when communication is so essential.
Gotcha. We're gonna take another break, a pause for the cause, because I'm talking you to death. but I love learning all of these things and reaffirming some of the things that we have talked about in the past. And I also want to talk about therapy and how we go about finding a good therapist and things like that. And you mentioned a number of different areas. You mentioned a
Mhm.
psychiatrist, you mentioned a counselor, you mentioned a therapist, and so I want to kind of break that down if we can,
Okay.
and give people a better idea of what we're looking for and looking at and looking for in our individual situations. My guest is the wonderful Dr. Altha Stewart, and she knows her stuff, ladies and gentlemen, and we're learning a lot here. And as we're going into the new year, giving us a lot to take stock of in terms of ourselves and where we go from here. So thanks for joining us, and we will be right back. And we are back with Dr. Altha Stewart. She has given us her time, and I don't know what your hourly rates are, but but I really appreciate this, Doc. I do want to remind people that your background is the past president of the American Psychiatric Association. That's a big deal, ladies and gentlemen. And as a member of the staff of the University of Tennessee there in Memphis, you are a psychiatrist.
Correct.
um can people come to a psychiatrist for therapy, or how do you start out finding a therapist and who works best for you?
Well, the psychiatrist is the medical doctor.
Mhm.
The and people are often confused about what's the difference between a psychiatrist and a psychologist.
Right.
If you have a primary care doctor, MD, I may have gone to school with medical school with that person. So we
Mhm.
spent 4 years in medical school. We did 3 or 4 additional years of training in what we call the residency.
Mhm.
And then we went out and continued to train and learn as we began to work in various settings, whether it's a hospital or a mental health clinic or private practice. So the psychiatrist is the MD in the behavioral health professions. The
Gotcha.
psychologist may be a PsyD or a PhD, but it's a non-medically trained. They have clinical training, but not medical training.
Mhm.
They didn't go to medical school, they went to graduate school. And many psychologists are, in fact, the primary therapists that people first see because you get referred to if you are seeing a primary care doc, for example, and say I'd like to talk to a therapist, it's
Mhm.
very likely that it'll be a psychologist who will be on your insurance panel or available with hours open to see you, or even in some settings these days working directly with the primary care doc for
Gotcha.
those things. And
Mhm.
so people have more access to psychologists because there are more of them.
Mhm.
And in today's world, for many people of color, they are looking for a therapist, whether it's a psychiatrist, a psychologist, a social worker, a counselor, a pastoral therapist, or whatever. They're looking for someone that they can feel comfortable
Mhm.
culturally with. And there are about, by our current numbers, there are only about 4,000 Black psychiatrists. And
Wow.
relatively, the numbers for other racial and ethnic groups are similar or lower.
Mhm.
And so everybody can't get a Black psychiatrist. Now, there is a group, the Black Psychiatrists of America, that tries to help people connect across the country with people who look like them, but there's just not enough. And so we've got to work on getting more young people interested in science so that they will do what they need to do going through school and get, third grade literacy is one marker, eighth
Mm.
grade algebra, 11th grade calculus. These are benchmarks
Yeah.
where we can identify that child who's going to want to go to grad school or medical school. And maybe then we've got a shot at convincing them to go into psychiatry or psychology.
Mhm.
We also need other specialties, but I'm
Sure.
focused on psychiatry, of
Eh,
course.
how did you
And
decide to become a psychiatrist?
can't you tell I love talking? I like to listen. More importantly, I like to listen.
Listen.
I was the
Mhm.
kid in high school and college. I was the person that people came and talked to, and I had to do relatively little to get people to talk to me. It's just kind of my personality. And in medical school, I realized that I wasn't that interested in procedural specialty, surgery and other stuff. I really liked that one-on-one communication. I liked exploring with people what they were thinking. I liked thinking about behavior and what it might mean, and then reflecting that back. Do you think this is what's going on? Because that's what it looks like to me.
Mhm.
And whatever my hourly rate is, you've always got an open ear, no matter what. Just I'm just saying.
Well, I'm really glad you became a psychiatrist because I think on the other side you could have been a bartender, and
And I can mix a good drink, but I don't know that it would be as helpful.
How about the process of finding the right therapist? Is there a is there a guide for those of us trying to find somebody?
Well, let's start with the word right,
Mm,
okay? Because
okay.
therapy, unlike some other things in medicine, you want to feel comfortable with your doctor no matter what you're seeing them for.
Mhm.
But therapy is where you are in many ways intimate with someone, in terms of letting them into your most private, secret, hidden away thoughts.
Right.
And so the fit is what I think you're talking about when
Mhm.
you say the right therapist.
That's it.
And I want
Yes.
to make that distinction because I want people who hear this to understand that when you first meet a therapist that you've been referred to, it may feel like it's not a good fit. And
Mhm.
a part of that, in my experience anyway, has to do with the fact that this may be someone that can see that thing you don't want seen.
Ah,
This
yeah.
may be someone who's going to risk saying that thing you don't want to hear, who's going to challenge you to let go of all of that stuff you've been holding on and hiding. And I've had many a patient who, when we started, they were convinced that we were not going to work, who have worked with me and come on the other side, come through to the other side, feeling like they got what they needed.
Mhm.
It doesn't always work, but I think people focus on that first visit as the sign of whether it's gonna work or not gonna work.
Right.
And that's really, it's not fair to you because we all have a sort of reluctance in first meetings
Right.
about how much to share, whether I can trust. Are they looking at me? Can they see that stuff that I'm trying to hide? Can they see behind my eyes and know what's really going on in my mind?
Right.
And that's not what happens at the first meeting. It's like the animals who are kind of squaring off to see who's going to reign in the territory.
Mhm.
And it's not that that kind of aggressive behavior, but it is a kind of a dance
Yeah.
of who's going to lead, how much I'm going to follow, what am I going to disclose, and can I trust you? And
Yeah.
people have a lot of tests around trust when they decide to go into therapy, which is one of the reasons they're going into therapy.
Right.
Um, so I would say one thing to do is not make the first visit the decision visit.
Mhm. Mhm.
I would say that be as open as you can about why you've come. You don't have to fully disclose your whole life history, but be as open as you can possibly be about when the therapist says, "What brings you in today?" Be
Mm.
as open as you can about the answer to that and challenge yourself. I would encourage. Challenge yourself to say, I've been thinking about this for a while. It's on my mind. And there are things that I think are troubling me enough that I'm not functioning the way I want to, or I'm not comfortable with the way my life is going, or I'm not comfortable around certain people, or I'm worried about how people, be as open as you can about what brings you there. And then let the therapist do their work,
Mm.
which is to pull that other stuff out.
Yeah.
When I said I love talking to people, it's because once they start talking to me, I've got something to hold on to dig a little deeper.
Right, right. That's fascinating to me, and just in terms of the listening and the opening up process, which is why dating. It just seems like you're trying to find that fit in
Mhm, mhm,
a professional relationship
mhm.
and in a personal
Yep.
relationship, and it just it works. How can people follow you, Dr. Altha Stewart, on social media?
My team forced me back when I was president. They forced me to get a Twitter account. I am not a social media by nature person, and it takes a lot of effort for me, but I do have a Twitter account at Dr. Altha Stewart. I will tell you, Sybil, and you probably have seen this if you follow me. I rarely post. I do a lot of reposting of
Mm-hmm.
things that I find either interesting or significant to share. My whole experience with social media is using it for disseminating accurate, factual information about how to have a healthy outlook on life, how to let go of some of the psychological challenges that hold people back, and sometimes just to share a feel good story
Right.
about somebody's experience that may resonate with somebody else who may be going through a similar thing. So I do have a Twitter account and I occasionally look at it. With the holidays coming up, I'll probably have time to look at it. But I cannot promise that I'm ever going to post something so original that
Right.
people are going to say, "Oh yeah." But I follow and am followed by people who do that. So I repost their stuff, and maybe that's attractive to people.
I appreciate that because I think we're on the same plane right there. There's just some stuff I'm not comfortable with.
Yeah.
Dr. Alta Stewart, you are a delight as always. Thank you for sharing your time and your information. I want to leave you all with Yogi's jewel for the day. The purpose of friends is to help you get through the highs and lows of life. I consider you to be a friend and as well as a guiding spirit in terms of this area of psychiatry and therapy and all that goes with it. Dr. Altha Stewart, thank you so much for joining us. I wish you a happy new year, and I'm going to borrow from you the two words of intention as well as grace as we go
Yes.
into 2022. Wishing you a happy new year, and to all those who are watching and listening to us today. We appreciate you. Thanks, Dr. Stewart.
Thank you so much, and happy New Year to you as well.
Thank you.
All right.